If I was describing the field of public health and epidemiology in 3 words, I would say it is evolving, collaborative and exciting. Our new public health and epidemiology major is only in the Bachelor of Biomedicine. Public health is part of everyone's life, although we might not identify it straight away. COVID-19 is a classic example where public health was very active. And as well, in public health, we look at issues such as vaping. What effect does it have on our health? What policies do we need? How do we set up health systems to improve people's health and ensure people have access to a wide range of health services? How do we fund those health systems? How do we speak to people about health and work to improve their health? Public health and epidemiology is ideal for people who love to solve problems and also to look at things in a complex way. Within our public health and epidemiology major, we have 3 core subjects and also 1 elective subject. And so students can really tailor that elective subject to be related to public health, but also related to their interests and where they're going to in the future. The first one is real-world epidemiology. And in that subject, we look at how we can use the numbers of disease to help solve important public health problems. In the other first semester subject, we have ethics and equity in health and medicine. The third subject in our major is one of the subjects in the second semester, and we are really excited about this subject. It is called Communicating for Health, Not Harm. It has a focus on what is happening at the moment in the world and how we communicate about health. So I think there are many reasons to study the public health and epidemiology major at the University of Melbourne. The University of Melbourne is number 1 for public health in Australia. And as well, it is a fantastic place to study. The students that you will meet, the staff and people that you will meet, you learn so many things that you don't expect to learn. The academics that we have teaching into the major are a group that are involved in the real world public health practice. They are thinking about how do we prevent this NCD? What are we doing about policy? They are thinking about how do we prevent mental health issues in adolescents. I think one of the great things about being at the University of Melbourne and studying public health is that we are located in the biomedical precinct. We have organisations around us that we work with and link with all of the time around our epidemiological work, our public health work. One of the things that I love about our major is that we're always tackling real-world problems. This could be racism, this could be vaping, this could be forever chemicals, for example. We really work with students in small groups and we discuss the issues that are at hand. And we work through real life problems that are happening in epidemiology and public health at the time that the students are studying. And we find solutions to these problems. So the things that students tell me that they love about this major is that they are looking at health from a big picture perspective. They are looking at the health of populations globally, nationally, and sometimes more locally as well. I think the subject that I am most excited about is our new capstone subject, Communicating for Health, Not Harm. The reasons I'm so excited about it is that I think it is looking at things that we see every day. We are bombarded with messages, dark marketing, greenwashing, pinkwashing, and pulling apart those messages that we see and responding to those messages and how to deal with them is just such an important component of what we will do in the field of health and what we do is important as everyday citizens. There are a wide range of careers in public health, and it really can be tailored to the person and your individual interests as a student. We will have graduates that move into a government space around health policy. We will have graduates that move into potentially a private space, consulting companies, etc. We will have students that often move into non-government organisations, places such as Red Cross, WHO, for example. Some students will move into research institutes such as the Murdoch Children's Research Institute, the Burnett Institute that focuses on global health as well, and also universities are another place where a lot of public health and epidemiological research takes place. These are growing industries at quite a rapid rate, and so there are many career options that I think we don't even know about yet in the future.